All right. Okay, so I'm doing my presentation over anxiety. What is anxiety? An emotion characterized by a feeling of tension, worried thoughts, and physical changes like increased blood pressure. Knowing the difference between normal feelings of anxiety and an anxiety disorder requiring medical attention can help a person identify and treat the condition. And then I have an anxiety video that's about 4 minutes long. Prevention of anxiety. There are lots of things that you can do to help. Consume less caffeine, tea, soda, and chocolate. Check with a doctor or pharmacist about over-the-counter or herbal remedies. Keep up a balanced, nutritious diet, regular sleep patterns. Avoid alcohol, cannabis, and other drugs. How is anxiety helped outside music therapy? Where to start? Finding a primary care physician, psychologist, psychiatrist, and psychiatric nurse practitioner all can be somebody to help. Doctors recommend these in some cases where one can manage anxiety on their own. Stress management, relaxation techniques, exercises to replace negative thoughts with positive ones, support network, and exercise. Sometimes, though, it takes more than just those recommended things. Counseling, therapy, which can include psychotherapy and medications, tricyclics, I can't say that word, tricyclics, those help with most anxiety disorders other than OCD. Benzodiazepines, highly addictive, is a problem that comes with those. Antidepressants, those give serotonin. They make you happy. And then there are others like beta blockers, monoamine oxidase inhibitors, and buspirone. Those are just a few of them. My first case study is called The Effect of Preferred Music. The effect of preferred music genre selection versus preferred song selection on experimentally induced anxiety levels. The study consisted of 90 individuals randomly assigned to the 3 groups below. This study investigated the difference of experimentally induced anxiety levels reached by subjects listening to no music, subjects listening to music selected by the experimenter from subjects' preferred genre or artist listed as relaxing. Subjects listening to a specific song they listed as relaxing, and the subjects filled out a questionnaire prior to telling what their preferred music was for relaxation. Subjects in group 1 marked preferred genre. Subjects in group 1 marked preferred genres and artists. Experimental group 2 marked specific songs used for relaxation purposes. The experimenter hypothesized that group 2 would show less anxiety than both the controlled group and group 1, but there was no significant differences There were no significant differences between the 2 music groups, although there was a statistical significant difference between no music control group and both music groups in anxiety levels reached by subjects. My next intervention is a pilot study exploring the use of online composed receptive music experience for students coping with stress and anxiety. This study actually used music therapy students in college and looked at their stressors related to academic, musical, and clinical development. The study literally said that music therapy students are one of the most stressed out students they could have used in this study. The object of the study was to investigate the use of online receptive music experience for music therapy students' stress and anxiety levels. It examined if a particular musical element was perceived as more beneficial in decreasing stress and anxiety. There were 23 participants, undergraduate and graduate, and it was an online study. This consisted of 5 single receptive music listening sessions They had the option to choose their listening environment, any method of playback, speakers, headphones, earbuds, and an option to play back more than once. Their measurement assessments use the therapeutic function of music, which articulates the function of the individual musical elements when designing experience for a specific therapeutic intent. Spielberg's State Trait Anxiety Inventory consists of 40 questions with 4 possible answers that helps professionals distinguish between a client's feelings of anxiety and depression, the stress overload scale, and a post-experience survey about musical element effectiveness. Results show that the music experience showed a significant decrease in student stress and anxiety levels. I have a music therapy video that's about 2 minutes long, and I believe it talks about somebody that had cancer and they had really bad anxiety during their procedures and stuff that they had to go through. So it's not specifically music therapy anxiety students, but it had a really good story to it. I still need to figure out what I'm going to do for my Rubin concept, so if anybody wants to help the sister out, because she's confused on that. And my bibliographies that I need to fix still. The end.